CLL is associated with a number of karyotype or cytogenetic abnormalities, meaning abnormalities of the chromosomes. One relatively uncommon abnormality that has not been explored very closely in CLL is something called tetraploidy, or actually whole genome doubling, meaning sometime as the cells are dividing, they had an event where the entirety of the chromosomes doubled. We've shown previously that in a very small cohort of patients, those patients that do have tetraploidy who are going on to ibrutinib with relapsed refractory CLL have a very high rate of Richter's transformation. We also know that a subset of Richter's transformation is characterized by this whole genome doubling. But really nobody has looked previously at what happens to patients just in general who have CLL and tetraploidy. So we looked back at our patient population treated at The Ohio State University over the past 20 years, and we have over 80 patients who developed whole genome doubling or tetraploidy during the course of their disease. And we found that in this entire cohort, almost half of them developed Richter's transformation, which is an extremely high number considering that when we look at the entirety of the CLL patient population, in various reports it's like 2 to 10%, so a much higher rate. And we found that specifically those patients who had loss of CDKN2A, which is a known marker that predicts Richter's transformation, as well as those patients with TP53 abnormalities, had an extremely high risk of transformation. So I think that these data are potentially very important because they identify a high-risk group of patients that you might want to watch very closely for the development of Richter's transformation and have a low suspicion for looking for Richters in these patients. We also are looking further at these data and looking at samples from laboratory samples from patients to see whether there might be specific drug targets that are that have the potential to be very effective in Richter's transformation with tetraploidy.